but I am super excited to be here, and I've done a lot of research and also done some structured behavior interventions in the past for toilet training for children specifically with autism. So before we dive in, I wanted to have a poll just to kind of see what everyone's experience level was. So if you could just let us know where you're at with toilet training. Would you consider yourself like a beginner? Do you have intermediate level? Are you advanced, expert? Where do you feel like you are with toilet training?
We have 83% of the votes in. Okay, we have everyone who voted.
Okay, awesome. So we have a pretty good, like a wide range. Expert, I haven't met an expert in toilet training yet, so I think that's a far-reaching goal, but maybe we could get there. So, well, good. So if you want to move on to the next slide, chat, that would be great. Okay, so first we just wanted to give a quick disclaimer. All research has been conducted in the United States. All strategies, skills are based on what has been done and found to work in the United States. Strategies are based on behavioral theories. We are not medical professionals, therefore, if need be, seek medical attention if you suspect any medical related concerns. Okay, agenda for today kind of covered in the goals that chat went over, but we're going to look at 4 categories for toilet training, and that's pre-toileting readiness, or what does it look like that for my child to be ready for toilet training? What might I see, signs, and then also what are the skills needed for toilet training? Preparing for toilet training, there's a few like such as the environment or caregivers, other critical components of helping to make the transition to toileting easier and more successful for the child. Teaching toileting, I had 3 popular strategies that we're going to go over, and then also some potential difficulties that are common and kind of ways to handle that, and then additional resources. So the additional resources are more leaning towards kids with autism. So I have a ton of autism resources for toilet training at the very end, which you guys can peruse at your leisure. So you mind moving on to the next slide? Okay, so first, we're going to talk about identifying if your child is toilet training ready or not. Does that video work, chat? I think we might have to go to a link. Oh, do you mind pausing it? Yeah.
Obviously, you've got to get the child when they're ready. Don't get me wrong. There have to be a time, and also boys and girls are different.
It needs to be a relaxing, comfortable transition for them, not a stressful and scary thing for them.
Okay, so we got it working. That's great. So we're going to talk about like the toileting readiness. So what are some signs? And I wanted to get a video of parents kind of discussing that, because who better knows their kid except parents. And then they'll also touch on some helpful strategies, which we're going to explain a little bit more in the training. So you can press play, chat. Thank you.
Can you see the screen?
Yes, yeah.
Obviously, you've got to get the child when they're ready. Don't get me wrong. There have to be a time, and also boys and girls are different.
It needs to be a relaxing, comfortable transition for them, not a stressful and scary thing for them.
You start to see the signs. They'll start to show interest in their parts, and when they're needing to go to the toilet, they'll start to cross their legs and pull at their pants, so you know that they're starting to feel when they need to go to the toilet.
He's now will tell you if he's done a poo. This is a very new thing he's learned to do, and we're quite proud of it.
Realising they've gone to the toilet in their nappy and they'll get a nappy and change. That's part of toilet training.
And they start to show interest in the toilet, like they want to flush the toilet or they want to watch you on the toilet. So that's all the steps and signs that they're starting to get ready to go to the toilet.
I'm just going to the toilet, doing a wee, and should be interested. And I thought, oh, that's good. So we bought a little potty.
I trained them with a normal toilet. All I got was a little step ladder. Every time I went to the toilet, they followed. Or I'd ask, I'd say, anybody want to go to the toilet? And they'd say, yep, me, mum. I'd say, come on then, mum, show ya.
I'd put him on the toilet and he'd jump up and he'd say nothing, and I'd say, come on, because we had the little story about the little engine that could, you know. I'd say, come on, I think I can, I think I can. And he'd be outside in the little hallway saying, I know I can't, I know I can't.
We really watched for him giving us indications of when he was ready to go and watched his routine.
In the summer, I let them run around with just a top on and no pants and keep the potty around so that they can see it and hope for the best.
Keep him out of the nappy as long as possible, make sure he's not on carpet, and we would just let him go. And he would then start to get the urge, and as soon as we saw, or after meal times, we'd grab him and stick him on the potty.
Everyone would be so excited when she'd go to the toilet, so she wanted to do it more, and then it just kind of flowed because she saw the reaction that she got, that everyone was so proud of her.
I got their first photos in the toilet too.
Okay. Awesome. Yeah. So those were just some parents talking a little bit about some signs that they saw in their children, and then some strategies that worked for them. So first, we could go to the next slide. We're going to just chat about the signs to start toilet training. So the three big ones are as follows. But before you can start this, it's best to talk with your child's pediatrician or general practitioner to help clear if a child is medically ready to begin toilet training. So some signs that they are not include having 2 or fewer bowel movements a week. So you kind of want to make sure that they're pretty regular. So constipation isn't a concern. And also, if you've noticed that your child has discomfort when eliminating either pee or poo, that can just be cue that there's some other medical concerns that are important to check out before you start toilet training. But some signs to start. So the first one is shows interest in toilet or uses toilet unprompted. So this might be them just kind of exploring it, sitting on the toilet, flushing it, watching others use it. It's pretty normal. Communicates the need to change, so that if they've soiled their diaper or their clothes, if they're wearing underwear, this might look like taking adults to the bathroom to change, or grabbing a new clean diaper and giving that to mom or dad. And also dislikes the feeling of a wet or soiled diaper or pull-up. So this might look like, again, kind of that desire to change right away when they've gone in their diaper. Or also they might throw a tantrum when they've gotten wet, and that's pretty indicative that, okay, they're starting to realize that they've gone in their diaper and they want to change. So those are the signs. Many people ask, what is the right age to start toilet training? And age is not necessarily the right question here. It may be helpful instead to ask these questions about the skills needed to toilet train. So these are some of those prerequisite skills that we make sure kids can have, or they do have before starting toileting. They kind of set the foundation for toileting skills. The first one being, does the child have the fine and gross motor skills to carry out a toileting routine? So can they get on the toilet? Can they flush the toilet? Can they take off their clothes? That sort of thing. Can the child pull their pants and underwear up or down with little to no assistance, or do they require you for that? And then, can the child imitate actions? That's a pretty big part of toileting, is they're going to be watching you do it. Another one that's not on here is following multi-step, 1 or 2 one or two instructions as well. So being able to listen and do what you've said. Can the child sit on a toilet without resistance? We need to make sure that it's kind of reinforcing to be there, because they're going to be there quite a bit during the teaching training. And so if it's difficult for them or they don't want to be there, then we may need to first start with some reinforcing strategies for them being in the bathroom or on the potty. Can the child identify where the bathroom is in their home? So that will help with self-initiation, which is the goal, is to have your child self-initiate going to the bathroom and being able to go by themselves. So rather than thinking about age, because a lot of these skills happen at different times for children based on their abilities. And so instead, we kind of want to look at like the skills required and does my child have that, rather than, oh, my child's 2, so therefore I have to start toilet training. Okay. All right, preparing for toilet training. It's important to think of toilet training as a process and not an instantaneous skill acquired. So this guy, he's yelling action, he wants it immediately. We need to flip that and make sure that we're aware that it's a process and it takes time. And we're going to talk about some ways to try and make this process less difficult and easier of a transition. Okay, so back to age. Like I said, there isn't a unanimously right time to start toilet training for all children. However, if you start pairing the bathroom or the toilet when the child's younger, they'll begin to realize that this is just a natural part of their routine. And good things result from being in the bathroom. If you wait until a child's older and then abruptly start potty training because they need to be potty trained because they're this old, right? That's the thinking. It might result in more resistance. So it's recommended that starting between 12 to 18 months, you try and pair the toilet or the bathroom with positive reinforcement. And you can do this by having the child practice sitting on the toilet with their favorite items, such as an iPad, an animal, a book, or something. And if need be, and if you're comfortable with it, having your child go to the bathroom with you. That's one of the parents' strategies in that video was bringing her children with her whenever she would go to the bathroom, so that they'd be more exposed to it. So, okay. The environment. So when preparing for toilet training, setting up the environment is critical for success. And some recommendations include removing all distractions not associated with toileting. So making it so that they can easily focus on the process rather than being distracted. Make the bathroom as comfortable as possible. This might mean getting foot supports, side rails, a smaller toilet seat, or some people call it like a potty trainer, just so that it's more acceptable and comfortable for them. Ensure everything in the bathroom is at the right level, specifically for your child. So the toilet paper isn't too far away that they can't reach it, or when they're washing their hands, the soap and the hand towels or paper towels aren't too far. So at your child's level, think about your child's sensory needs and make changes to reduce their anxiety. This is especially helpful for our kiddos with autism spectrum disorder. You want to think about, is the lighting too bright? Does the noise of the fan bother them? Maybe I should turn that off. Or is the soap too strong? And some of those things you might not be able to remove to reduce their anxiety. And one of the ways to kind of help with that is desensitization, or increasing exposure to those more aversive things, because they can't be eliminated, right? But where you can, make the changes. And then the last one is supply and organize all materials for toilet training beforehand. So toilet training is coming. You've seen the signs. Kind of getting those supplies ready so you don't have to be too worried or scrambling for everything whenever you start. So that might include wipes, extra cleaning supplies if there's an accident, underwear, the activity bin with like some of their fun toys, so on and so forth. So the environment's really important.
Yeah, and to that also, Keely, like just going back to distractions, it could be the unnecessary toys, or sometimes, families have the washing machine in the bathroom and just like having that running and the noise, that they could just focus their attention on, and really forget the whole goal of being seated on the toilet. So there's also another thing, and sometimes, Keely, I'm not going to touch a lot because I know that you'll be kind of covering that, like giving kids something to engage with as they're seated on the toilet. So with that, except for that, just like removing all the toys, or anything that they might want to get up and go and engage with. So just being mindful of removing those.
Yeah, that is great. Great reminder. Okay, so whenever you start seeing the signs that your child is toilet training ready, so the day's coming, it's good to increase exposure to the toilet and the toileting process. And some tips to increase exposure include changing all diapers in the bathroom. So having the changing process be in the bathroom so that they're more used to that environment for the toileting. And then using agreed upon language during the changing process. This is a big one that we're going to highlight kind of throughout today's training. But as you heard in the video, people use potty or toilet or restroom or bathroom. And we might all know what those words mean, which is the same thing. But for a child, you want to make sure that there's an agreed upon language and it's pretty consistent. So potty versus toilet, pee versus urinate, poop versus bowel movement. You want to make sure that everyone agrees on it, and to increase exposure, you're using that language while you're changing them. So you went poo-poo in your diaper. I now need to wipe to clean the poo. That sort of thing, familiarizing them with the language. Also, do not allow other activities to go on during changing. What Chat was talking about was kind of like with those toys. It will distract them from kind of like, oh, okay, I'm being changed. This is where toileting happens, to limit distractions. Then if they did poop in their diaper, have them shake the solid waste into the toilet. Comment, poop goes in the potty, and then practice flushing the toilet and letting them hear that noise if they haven't heard it that much before. You can also see if that noise is aversive to them and if that's something you need to work on. And then having them even more part of the changing process. So helping with the wiping and putting that in the toilet and flushing it. So increasing exposure when you know toilet training is coming up. So
also, we want to make sure we remove items before we begin this process, because in the middle of changing, they find an item, you don't want to take that away at that moment, which is not going to be pleasant.
Oh yeah, very true. Okay, so the most critical piece of toilet training is the caregiver or whoever is conducting this toilet training. We want to make sure that caregivers are prepared. So we recommend they dedicate ample time to work with the child on toilet training, and also doing it during a time of limited stress. So not trying to do toilet training during a move, or if there was a new baby or a major illness. The caregivers need to have enough time to focus on it, as well as enough mental and emotional energy to focus on this process. I've known some clients and families to do it over a 3-day weekend or a holiday break, 1 week. It just really depends, but you know your child, so you kind of know their learning process and what it might take. Also, we recommend that caregivers emotionally prepare for setbacks and cleanups early on. Accidents will happen. it just, parents need to kind of emotionally prepare for that. And then finally, coordinating with others involved in the child's life. So this might be biological parents, might be caretakers or sitters, grandparents. We consider this the toileting team. You want to ensure that everyone working with the child starts the toilet training at the same time and follows that agreed upon language like we talked about. So everyone's using potty, everyone's using urinate or bowel movement. Also sending in any equipment to daycare or data sheets, like spare clothes, plastic bags, potty trainer seat, so that everyone's not scrambling and they're helping out each other and keeping it consistent for the child. It's important that everyone has a clean line of communication during this time, to share concerns and successes. It also may be helpful to, oh yeah, you can go to this next page, chat, sorry. It's also helpful to go to create a toileting goal plan to share with the team so that everyone's on the same page. So this is kind of an example goal plan of toilet training. So the goal is to have Tommy visit the restroom 15 minutes after his meal and sit on the toilet for 5 seconds. This can be individualized to your child. And then you would describe the routine of toileting for Tommy is his name. For Tommy, like how often does he go to the bathroom? How long is he visiting the restroom and sitting on the toilet? The language used, what does the environment look like? The tools, so what activities is he doing while on the toilet? And then what are his rewards if he goes on the toilet? So that can be helpful to kind of keep it consistent across people who are caring for the child. Okay, so now we have our second poll. Okay, and so it's when toilet training, how long should you let the child practice sitting on the toilet? 30 seconds, 2 to 3 minutes, 10 to 20 minutes, or any of the above?
We have half of the people who voted. Okay, still coming in.
Okay, awesome. Great. Okay, so the answer is any of the above. It's kind of a trick question. So you'll see in any research, or if you're going on the Google and being like, how long should my child sit on the toilet during training? And you're going to get a plethora of answers. And I would say it's similar to the age question of that. It's very dependent on the child. So if you have a child with ADHD, 30 seconds on the toilet might be a huge victory, whereas another child might be able to sit on the toilet for 10 minutes, and that's all that they can do, or they could do more. The only thing we want to make sure is that forever long they're sitting on the toilet, that it doesn't become aversive or like a punishment to them. So 30 minutes is a little excessive. But again, it's dependent on where they are developmentally, how much they can handle, and what is the line between practicing and punishment. So we're about to go into teaching toileting, and I just want to let you guys know that we are going to focus on peeing or urinate during this time, as this happens more frequently. And then once a child is successful with peeing, it's usually the easier skill to get. Then we would move on to bowel movement. So usually the progression of toilet training is I'm sorry, I'm blanking on the word. is toilet training for peeing, toilet training for bowel movements, self-initiation, toilet training, and then also bedtime toilet training. So once your child's successfully urinating on the toilet by themselves, and then when they're going poop on the toilet by themselves, then we move into working on self-initiation, and then we move into bedtime. So just a heads up, this is all kind of focused on peeing. And the resources at the end that I give will also kind of focus on those other later steps. But so trip training is a highly popular and effective strategy to toilet train, but it can be time and effort intensive. And before we dive into the steps, the first thing that you need to do is the child should be in their underwear. So toilet training day, say it's a long 3-day weekend, you wake up on a Saturday, you have the child put on their underwear, and we're going to begin trip training. That way they can feel the wetness if they have an accident, and it speeds up the learning process. So step one, you want to increase the fluid intake. You want to verify with a general practitioner or pediatrician the appropriate level of liquid, but the goal would be about 8 to 10 cups of liquid per day. You can also feed your child saltier foods if they're not a big fluid drinker like water, or you can target foods that have more fluids in them like fruits or popsicles. It's good to remember that this fluid loading or water loading is only temporary, just until the toilet training is starting to be more successful. Step two, so you're increasing fluid intake. You're going to set a timer for 20 minutes, and then you're going to consistently take the child to sit on the toilet every 20 minutes. When the timer goes off, you're going to say, time to go to the potty. The frequency of 20 minutes can change again, depending on the child. If they need to go more frequently than that, the timer could be 10 minutes. Or if you know that they go every 30 minutes, it can be 30 minutes. Once you get to the bathroom, you want to check to see if the child is dry or wet. If they're dry, you want to provide positive praise and an item from the reinforcement bin. So you're going to have a little collection of reinforcement items beforehand. That's part of supplying the environment, as well as the activity bin. And so if they're dry, you give them maybe like a sticker, a little pencil, something cheap, because you're going to be going to the bathroom quite often. But then if the child is wet or has soiled their underwear, remain calm and in a neutral voice, point out that the child has had a pee or poo accident. Make sure you change their underwear and remind them where the pee or poop goes. Okay, step three. So you're in the bathroom. You want to set the timer for 5 minutes. Again, this time is dependent on the child's developmental level, and have them sit on the toilet for 5 or 10 minutes. Keep them entertained while they're sitting on the toilet. You can read to them or have them play with toys in the activity bin. If this is successful, as in if they pee or poop in the potty, you want to have a party, basically, reinforced with positive praise and an item from the reinforcement bin. So they get an item from the reinforcement bin if they come to the bathroom dry and if they also eliminate in the potty. If not successful, have the child feel their underwear and remind them to stay dry and just complete the toileting routine. Step 4 is the last one. You want to repeat this process until bedtime and put the diaper or pull-up on the child. Remember to take data. I totally forgot to talk about that. Sorry. On step 2 and step 3, we need to be taking data. And it's important to share these data sheets with all of the caregivers or school daycare professionals. Whoever's working on toileting should have these data sheets. So after step 4, and you've been doing it for a while, it's really important to systematically fade the toilet training protocol. After 2 days of consistently having successes in the toilet, so they're going to the bathroom in the toilet without accidents, you want to start to decrease the child's fluid intake and increase the time the child is taken to the bathroom from every 20 minutes to 30 minutes to 45 to an hour. So that period of time is getting to be a little bit more realistic of when they're going to the bathroom. And then when your child has more successes than accidents, the child is on their way to being potty trained. If you want to go to the next slide, it has.
I want to
Oh yeah.
quickly talk about under step 2 when you mentioned like neutral kind of tone. It's super important. Sometimes as caregivers, we may be disappointed, right? If things don't go the way we want it to go. We may be rushing to work in the morning and we have XYZ to attend. So it's very easy to get frustrated and, not have that neutral voice. So just, constantly reminding, and I think like Keely said, this entire process needs patience. So it's something to sit with and talk through your partners and come up with a plan. And like Keely said, the toileting team essentially, and making sure everyone's on the same page.
So here's some data sheets, and they're kind of, I see now that they're a little small. I apologize. But this first one is one that I really like on the left side. You have the date and the time, and then you have the yes and no options for the following columns. So did they void in the toilet? That could be either pee or poop. Were they dry, wet, or had they soiled their underwear when they got to the bathroom? And did they self-initiate, or was this from your prompting or when the timer went off? These were the sheets that you should share with the toileting team, so that if you drop your child off at school or daycare, you kind of know, oh, okay, my child had a bowel movement today. I shouldn't expect another one tomorrow. That kind of helps too later on with figuring out if your child's constipated or regular. And also for you to be able to celebrate the victories at home and praise your child if they do void or if they stay dry. Okay, so 2 other strategies that are really helpful, especially for our kiddos who need a little bit more help with transitioning to toileting. So this first one on the left, visual supports, or commonly called visual schedules, can help reinforce the routine of toileting and provide reminders for taking regular toilet breaks. So for here, this one's pretty simple. One of the resources I have at the end has so many free visual schedules for toilet training that you can kind of create and put together yourself. It's really cool, but has just the necessary pictures here: pants down, sit on toilet, use toilet paper to wipe, pants up, wash hands. You want to make sure with these visual schedules that you go over them about at least 2 or 3 times a day. This can be happening when you're trying to increase exposure, so in the preparing for toileting, while also during the teaching toileting as well. Make sure the toileting team knows how to use these visual schedules, as well as has access to them. And then the last strategy that we'll talk about is the social story. And this is actually a video, but I don't think we'll have time to watch it. And it's a little silly, but it's pretty fun for kids. But social stories are used to help develop appropriate behavior and responses, like going to the bathroom and the toilet. They can help cope with challenging and new situations. So for some of our kiddos, toilets are scary, and it's just a really novel stimulus. And so they need a little bit more acclimation, and these social stories can be really helpful. I think the ones especially that are videos are a little bit more entertaining for kids rather than the books or the printout ones, but those are still better than nothing. And I think all would work. I also have a good resource where I got this social story, and they have a ton of other free video social stories for toilet training. So I'll point that out to you at the end, but those are the 3 big ones.
And Keely, if there are any resources you'd like folks to have, you can go ahead and send me like documents or links, and we can send them out. So
Yeah, I got a ton of resources for y'all. Okay, so now we're going to talk a little bit about potential difficulties, and we have our last and final poll question for this one. Okay, if accidents happen, the child has failed toilet training. True or false? Okay, yes, so it's false, and you can go to the next slide. So an occasional accident can happen to any child. If it seems irregular and not very common for your child, it can be important to rule out any medical problems. Also, any dietary or medication changes could have caused this. So they just had a little bit too much to drink that day, or all they ate that day was fruits. Then it's more likely that they would have to urinate more, or some medication might cause less bowel control or bladder control. If they do have an accident, we want to try to make as little deal of it as possible. So kind of what Chat was saying was like, it can be really frustrating. And one of those preparing for toileting tips is emotionally preparing for setbacks and cleanups and so forth early on. But if your child has an accident, try to minimize discussing, ridiculing, pleading, or teasing. Because these could have the unintended result of reinforcing the accident behavior. So it could be a lot of attention that the child is actually enjoying, and they might be more likely to have an accident. But it's also good to not make a big deal of it, just to kind of avoid the whole shame factor, because it happens to every kiddo. And then so you don't make a big deal of it. Instead, provide a brief reminder that you expect your child to use the toilet in the future, and complete the cleanup with little attention or discussion as possible. One possibility for an accident that happens commonly is that the child has become schedule or prompt dependent. So they use their toilet training skills at home, and they've become self-initiators. So they're going to the bathroom by themselves. Say they go to a summer program or a camp, or a new classroom, and the only time they're allowed to go to the bathroom is when the teacher says, or the camp counselor says that it's time to go to the bathroom. Well, they might be dependent on that verbal reminder from the leader to go to the bathroom, or they're going to the bathroom every 2 hours. So they're just used to going every 2 hours rather than whenever they have the feeling. So if that's the case, it's important to make sure the child has opportunities to initiate and request to use the bathroom on their own. Okay. You can go to the next one. So constipation is one of those, the last potential and pretty typical difficulties. It's important to know that normal bowel movements vary among everybody, and children including. So some kids may have bowel movements every 2 to 3 times a day, or others have them one every 2 to 3 days. So it's good to know beforehand kind of what is your child's routine in that regard, so that when day 3 comes around and they normally go on day 2, that you can be like, okay, something's wrong. I think my child's constipated, and kind of take action with that. Constipation is common for children. If your child is not having BMs regularly, it's likely that they are constipated. Constipation is usually caused by not enough fluids like water or fiber in their diet. If you are really concerned, you can talk with your child's pediatrician or general practitioner to rule out any medical concerns. And if your child is constipated or regular bowel movements just aren't happening for for them. You can pause the toilet training if it seems too much of a battle and come back to it once your child is more regular. It's really important that they get regular before starting toilet training.
And yeah, I just want to also stress, if you do see signs of constipation, always, I think observation is good, but some of the first things that you should be doing is talking with your pediatrician.
Okay, and so this last slide before we go on to questions is just those resources that I'll give chat to kind of send to you all. The last two, the free potty training social stories, is where they have a ton of social stories for different biological sexes and for caregivers, for teachers. And then also the last one is with visual supports. So things that you can play around with and make your own visual supports. Okay, so in the last few minutes, we'll open it up to questions.
I think this is perfect timing, Keely. And maybe this is like a lot of information for some of y'all. And questions don't need to specifically be about what we covered. If there's like any cases that are specific, or any questions that are specific to your students, because I know here we have daycare teachers and teachers who work with little older kids. So any questions like we've had in the past specific to students you work with, we're open to those. Stop sharing. And as we wait for questions, I'm going to pull up the remaining portion.
I will say, as questions are coming in, one of the best strategies for older kids in toilet training is called habit training. And there's a lot of research on that, and I can put that in the chat for older kids rather than trip training, which is what we covered today.
Thanks, Keely. Have any of y'all like experienced situations where you have had, children coming in who haven't been toilet trained, or any experiences where you had to kind of continue that training in your educational setting? Yeah, and sometimes maybe y'all don't have questions because maybe y'all haven't, had those opportunities, and that's okay. Sometimes a lot of kiddos who do come into daycares are toilet trained, and parents have done kind of all of that work up front just so that things are much smoother when they start school. But in case in future you do have, we will send you this recording so you can listen to it and hit Keely or I with any questions that you have. But with that, I want to give you a quick reminder. Next week is actually our last session for this series. It's crazy how 9 weeks have flown by. And those of you who joined us for our first session, we had Dr. Burnett. She spoke about kind of the diagnostic portion very briefly about autism. So she will kind of be joining us next session to expand on the diagnostic portion of autism spectrum disorder. And with that, we also have a speech and language pathologist, Leslie Van Winkle, who will also be joining us. So we're kind of going to do a split session for next week. And bringing in Leslie was kind of like a spot-on decision given some of the questions that we have had around speech. And I recognized that we hadn't included kind of a session dedicated to speech only. So we will have Leslie and Dr. Burnett join us next week to speak about speech communication with and without relation to, so in relation to autism, but also for children who are typically developing and who are kind of delayed with those communication skills. She'll be sure to touch on those as well. So feel free to register. I did have the link somewhere in here. Okay, let me put this on here. If you have not registered, it's the same registration form. So if you already have registered, you don't have to re-register again. So one registration is totally enough. So with that, that kind of comes to the end of our presentation.